passionate doctor. I'm called 24/7. Dr. Sugar can answer your questions. She's an inspiration.
Hello, I'm Dr. Sugar, your internet doctor, here to give you your dose of medical inspiration for the day. Thanks for watching. Our topic is bronchiolitis. So let's get started, shall we? One cold, calm night during sound sleep, you get disturbed and awake suddenly to the whistling, wheezing sound of your baby lying in the bassinet near your bed. When you turn on the light and move close to make sure the baby is safe, to your surprise, you find that your baby is uneasy. You caress your baby to soothe him, but he feels hot and his breathing is labored and his face is red. And you find yourself feeling helpless in your attempts to help your baby, and you do not understand what's happening. But do not panic. This is very likely a respiratory disease of the bronchioles, or the little pipes of the lungs, and these are the symptoms of bronchiolitis. Bronchiolitis is an inflammation of the small passages in the lungs. These are called the bronchioles, and it is usually caused by a viral infection. Now, bronchiolitis usually affects children under the age of 2, with a peak between the ages of 3 to 6 months. It's a common illness that can be severe, especially in infants. One of the viruses around us is called respiratory syncytial virus, or for short RSV. And RSV is the prime culprit causing bronchiolitis. Respiratory syncytial virus is a very, very common virus. This virus causes mild, cold-like symptoms in adults and older, healthy children. However, it can cause serious respiratory infections in young babies, especially those in certain high-risk groups. Now, there are some other viruses that can cause bronchiolitis as well, and these are adenovirus, influenza, and parainfluenza virus. Now, RSV is spread very easily by physical contact. Touching, kissing, sharing drinks or even utensils, and even shaking hands with an infected person can spread RSV. Transmission is usually by contact with contaminated secretions, which may involve tiny droplets or objects that the droplets have touched. So when someone has coughed or sneezed on a doorknob or other surface, you can come along and open that door and get the virus on your hand. Then simply touching your nose, mouth, or face can infect you with the virus. Now, RSV can live for half an hour or more on your hands. So it's not like you touch the doorknob and touch your face immediately. Anytime over the next half hour, if you get your hand near your face, that's a good chance that you could become infected. In addition to that, the virus can also live up to 5 hours on countertops and for several hours on used tissues. RSV often spreads very rapidly in crowded households, and it also spreads very rapidly in daycare centers. Now, as I said, RSV generally causes only mild cold-like symptoms in an adult or an older child, but it can cause a severe, severe illness in an infant. I'm Dr. Sugar, and I want to invite you to join me for part 2 of my medical inspiration video series on understanding bronchiolitis. In the next section, you will learn who gets bronchiolitis and what the symptoms and the risk factors are. So make sure to check it out, and I'll see you there.